Hi, my name's Steph. I am the founder of Surgery App, and in this video we're going to give you a brief overview of the main features of Surgery App and why we built it. So I was a practice manager in primary care for 17 years and a cluster lead. We built the app with patient feedback and GP and practice manager feedback and built a one-stop shop really for patients to be able to access all your services, while at the same time trying to reduce inappropriate phone calls coming through to surgeries and allocating or pushing patients to the right services at the right time. So we're going to share screen now and show you an overview of the app. So here we go. We'll make this a full screen. So when a patient downloads the app from either the Apple or from the Google or Apple Play stores, they come to this registration page and they put their first name, surname, email and date of birth in the mobile number, and then they can choose their surgery. They can either use a geolocator, which is automatically built into the app, or they can type their surgery name in and search, and if you have branch surgeries, it'll bring up all your branch surgeries. They can then select their surgery and they come then to the app's homepage. So we've built the app on a scrolling basis to mirror what patients use on Facebook or social media or Instagram, for example. The first page they come to is the app's homepage. There are 4 tabs along the bottom, which are Home, Health Hub, Your Surgery, and What's On. We'll concentrate first on the homepage. So it'll give the Your Surgery details. We also have a section for PCNs or GP clusters. So to also tell your patients all about what your PCN or your cluster does. We've got a section here for them. There are explainer videos here in English and in Welsh to tell patients all about what clusters or PCNs do. It's only a 2-minute video, so it's an explainer video there. But you can also put in news updates or projects you've got in the community, upcoming projects. Some PCNs or clusters have podcasts. So you can put any information you want pertinent to your cluster or PCN on this section here, and that gives your cluster of PCN a real voice and presence and tells patients what it's all about. Moving on, we then have news. So you can, to accompany the app, there's also a portal which informs information in the app. Now, please do remember that this is a fully managed service. So what I mean by that is, when I was a PM, I always found it difficult to update my practice website, or I didn't have time for it. So we're offering a fully managed service. So if you don't have time to do anything, like if you have a new doctor starting, simply email us that information and we can put that information into the portal here for you, and that will update the app for you automatically. So to try and save time for you guys, because as PMs, you're incredibly busy, you're multitasking all day long. You may forget to update the website from time to time. With the app, we do have a website offering coming soon in May. Anything you put into the portal will then update the app automatically, and simultaneously will also update the website for you, so take that burden away from you. So anything you put in here will update in the app. So you can create news events, and if you create a news event, let's go in and edit one now, or you can add a new event, or let's edit one. If it is an important news event, you can show that as a news flash. So if it's a news flash, something to do with COVID, during COVID times, that would be good to have, wouldn't it? Then we can put a news flash, and that will always appear at the top of the app here. Any other news events will appear at the bottom of the page here, but anything important will appear at the top. Scrolling down, then we have some patient information pages. So again, we can build these for you, or you can do it yourself in the app here. This is a patient information page builder. And again, you can click on this and click on Add New, and then follow the instructions in the portal to build that page. But again, we can build that for you. And also sometimes we do build, if it's a national incentive, we build the information pages for you, such as in Wales, we've now have the NHS COVID Pass exemption protocol. So we've now built that, so if anybody can download that, and it'll automatically put that page in there that we've built for you. And you can choose in the app where you want to put these information pages and make them inactive or inactive. So those are just information pages for patients which may be relevant from time to time. Next, we have arrive yourself a face-to-face appointment. So a lot of such surveys now, they've always traditionally used companies. When I was PM, I used JX. Others may use NewMed or Engage Health. These companies now do offer remote check-in for patients as long as they're within a certain distance from the surgery. Again, let me make this clear. You can enable or disable any of these features. So if you didn't have remote check-in, all we would do for you is to come into the portal, and again, we build all this for you. But if there's no check-in, then you just simply untick that, and that will take that button out of the app for you. Anything that has a tick in it means it's visible for patients in the app. If we simply untick that now and click save, that would take that button out. But they can use this now to arrive themselves, and it's been really well received from patients because it can help to avoid long queues in reception if patients are checking in for appointments. A lot of them didn't like to use the keypads in reception, so this button is now available for them. And if you have multiple locations, again, like this surgery, they have a main surgery and then 2 branch surgeries. We can then again set that up for you. You can add as many locations as you want to. This has actually worked quite well because some practices where I used to work, we employed a physiotherapist, but the physiotherapist is located in different surgeries. They're shared around the surgeries, so we can add that in as well, so patients can check in that way to correct locations. But again, if you didn't want to enable that, just untick it, or we untick it for you. Just let us know, and that button will not appear in the app. So if I delete these locations now, just do that quickly for you, and untick remote check-in and click on save. If I go back into the app and refresh it, then you can see that that button has now disappeared. Okay, the next button. So I need help with a medical issue. So a lot of surgeries use online triage platforms like eConsult, Ask My GP, Engage Health, AccuRx. If you do use those services, again, we can integrate with, or we can link to those services for you, just like you linked to it on your website. So again, in the portal, you will tell us who you're with, or we can get it from your website. And then when it says online triage, we can link to Ask My GP, eConsult, Engage Health, AccuRx, Clinic, EMIS, or anything else really. And we put that URL in there. And then when a patient clicks on I need help with a medical issue, they can click on this button and it'll take them then directly to the eConsult platform for your particular practice. So that's a really good way. Again, I said at the start, this is a one-stop shop for patients to find everything relating to you. Again, that they can inquiries. So about 40% of calls coming through to you guys, we've done some sort of research on this, are related to admin queries. So if we can help to stop those queries coming through to you, any such queries like I want a doctor's letter or a sick note or a continuation paper, things like that, they can take a lot of time and log jam your phones, and you may not reach your access guidelines. So we can build admin queries for you, forms in the app. So if a patient clicks on I have an admin query, again, if you have an eConsult or an AccuRx platform, we can link directly to that. Or if you don't have that, we can build the forms for you. And we've got a custom form builder here, and we've got lots and lots of forms for you to choose from. You can enable and disable them. For example, here, acute prescription request. We can build that for you specific to your requirements. Let's make that full screen so you can see everything. And then we can put any kind of field you want in. So you can really make it bespoke to what you want the patient to answer. So when the form is submitted, you've got all the questions there answered ready. We can make them mandatory or not mandatory, whatever you do. But again, we build these forms for you. We can select the location for them. You can put them as a main admin screen, or you can put them behind the button for admin queries. We can make it active or inactive, and we can have them coming to your email address. Or we've got a workflow management system, which is shown in another video, where forms come into the database. And then instead of coming into your inquiries at our email address, they come into our workflow management system, which is a kind of smart inbox for you, which has a full audit trail for all forms coming in. But that's, as I said, shown in a different video. But this button here really does help your patients to avoid having to phone you and submitting things through to you digitally from now on. Things like notification of change of address, submit a photo only if requested by a clinician. All these forms can be built to your specifications and made available for the patient, and that's proving very, very effective in the app. So the next button along then is order repeat prescriptions. So if you have an online ordering system, in Wales you have My Health Online, in England you have NHS Login, in Scotland and Ireland you have EMIS or Vision Login. We can link to that as well. So when patients click on here, it's got instructions for them. If they don't already have an account, they can now register for online services through the app, and the form is submitted to you digitally with all of the patients' ID attached to the form, their passport or driver's license, proof of address, and also a short video which identifies them with a good likeliness then to the ID they send in. Once that's received by you, get an email notification to tell you a patient has requested online access, and then you process that in a normal way. If in England you've got NHS Login, then that's taken out of your hands, and NHS Digital do all the verification and set up the account for the patient that way. If they've already got an account, then they simply click on order repeat medication, and it'll take the patient through to whichever online system you have. We take that from your website, EMIS or Vision or System 1 TPP, so we can link to that directly. If you want to give patients a message to say please allow 2 working days, then we can edit that from the portal. Again, we will do all of this for you. If we go down to here and meds, we can put any instructions in here. And if you also allow patients to email you or to phone you, if you've got a centralized phone line for medication requests, we can also update those. If also you allow patients to submit requests for repeats through your online triage platform, we can also put that link in there for patients. We can also let's make that do that really quickly. 2 3 4 4 7 4 7, and sorry, I'll cut that. We can put the phone number in there, so that's our phone number, and email. Let's put our work email address in and save that. So if I go back in there now and refresh and click on that button for order repeats, then all 3 are there. So it really gives you flexibility as to how you want patients to access those services. Okay, so let's repeat. So next is acute prescription requests. So a lot of time patients have to come down to complete that, or they can email you. Well, we now have a form which allows a patient to request an acute script over the phone, through the app, sorry. So they can fill out this form, and again, that is sent to you. It can either be emailed to your inquiries or admin@email address in your practice, or it can be submitted to the form submission here. We've got some examples here, as you can see, for acute, not a repeat prescription request, but we show you that in a different video for the workflow management system. But again, patients can use that. Again, they can upload a discharge summary if they wanted to, medication discharge summary from the hospital. They can choose to do that or not. But again, we can build this form again to your specifications to ensure patients answer the questions you want answered before you process that application. Next then is book a blood test. So a lot of health boards are now offering patients the ability to book a blood test online. This example is for Swansea Bay Health Board. When a patient clicks on this, it takes them to the Swansea Bay phlebotomy booking service. Patient can select from 4 locations for this health board, click a date, and then they can book in for that if there's availability. They can book in there. If your health board doesn't offer that, we can also link to any internal system you have for booking blood that way. The next button is Self-Referral Hub. So a lot of surgeries have self-referral forms on your website, but it's quite difficult for patients actually to self-refer, because very often it's a PDF. They have to download it, print it, write it out, either scan it back into email to the department or post it off. Well, that's quite restrictive for patients, we find. So we can build those forms into the app for you. So if you have any referral forms for physiotherapy, podiatry, anything like that, send the forms to us. We will build those forms for you. And this example here shows a cancer fatigue referral form, which we've built. And then we build the form exactly as it is, as the patient would print it out as a PDF, but they can easily fill it out within the app and send it off. And then we code it we code the form. So that, let's see here, cancer fatigue. We coded that so that we put in the email address of the health board, that if the patient were printing out the PDF, usually there's an email on the bottom to say, please email this to. We code it in the background so that when the form is submitted, it doesn't come back to surgery, it's sent directly to the department for them to receive that referral form then. Okay, what's next? So we've gone through all of these so far. Okay, mental health and well-being. So this is very topical. Approximately 10% of consultations in primary care relate to mental health and well-being. So it's very important to have that facility in the app for patients to self-refer and find services in there. So we can build that mental health and well-being functionality for you. We can drop a lot of educational videos in there, but again, we would build that based on the services available in your area, in your locality. We can either get that from the health board website, or you can send it to us and we would build that for you, and it's specific to your surgery locality and health board. Okay, next is NHS Health and Care Video Library. So this is a video library for patients to use, and it's short, informative videos. We've got analytics built into the app, so that if you click on this button, you can see find a report on what patients are doing. We found that a lot of hits are coming from short, informative videos for patients. So if they click on this button, it'll take them to the entire NHS library, built by NHSX. This should appear soon. Sorry, my internet is a bit slow. So that'll come up. And for example, as you can see, there's lots of topics here. They can scroll to find what they're looking for. But if I was to click on diabetes, then there's lots of information here for patients then on self-care and how to manage any sort of ailment, really. They can watch these videos, and it works really well on a smart device like a phone or a tablet, and they can watch them, what is pre-diabetes, healthy eating. There's lots of stuff there. So again, that can be put into the app for you, and it's really good. And when any new videos are uploaded, it updates in the app automatically without us or you having to do that. Okay, next is I want help for my condition. So much the same as this is a video library, we put localized pathways in here. So patients will very, very often say, I've Googled this, I think I've got this. Well, very often they haven't. So we've imported the entire NHS directory of health resources into the app. So here you can see the A to Z of health. So they can start there and they can scroll to find what they're looking for. Or they can Google what they're looking for. So if I was to type in now, mental health, which we've just discussed that, and it brings up, there we are, Mental Health Hub of Wales, or the localized information in addition to the national health information. And again, we update all this for you. You can also send information to us by email, and we'll update it for you for more localized stuff. But we update all the national information for you as you're in the app for you. Again, COVID Pass, that's not so prevalent now, but it is for some people. And again, we have put in there the information. They can get a link then directly to the COVID Pass travel, but we also have put information in there for the exemption certificate and the application then for patients to have an exempt COVID Pass if they do qualify for that. So that is live. COVID Information Hub, again, the hub is in there for patients. There's a information about how to get your COVID Pass, how to go about booking. We can link to health board booking forms for first, second, third immunocompromised or child and booster. So that all that information is there. Again, if you didn't want to enable that because it's not so topical anymore, again, that's fine. We can just go into your portal and we can disable it very easily by unticking where it says COVID Information Hub. So if I untick that now and click Save, again, that button will disappear from the app's homepage. There we are, that's gone. Okay, so the next button then is book appointments. So a lot of surgeons are now offering booking appointments for non-urgent, and some are doing also urgent for triage. If they've got triage slots on your EMIS or vision appointment system. Again, any system you have, we can link to that. We can also build information pages behind here to tell patients what they can book for. If it's an on-the-day appointment, they need to phone, and then we can link to specific slots. So I think we've got an example of that in here for appointment booking. Let's have a look. Appointments. Okay, we don't. So yeah, we can link to anything. So if you've got specific slots like nurse appointments or dressings, we can link to that also to sort of inform patients, don't give us emergency, you phone, anything else you can book online. But you tell us what you're allowed to book online, and then we build that in the app for you so the patients can book online as well. And also when they click on that button, they can register for online services as well if they haven't already registered. Next is check your symptoms. So this defaults at the moment to the NHS Wales symptom checker. But if you are in a surgery in England, Scotland, or Ireland, again, we can put the symptom checker and we just link it to your country's symptom checker, and then that will link to the relevant department. Okay, again, there's another button there for register for online services. So if somebody if they don't realize they have to click on this button to register, then there's a simple quick register button here for patients to register for any online service with EMIS Vision or System 1. Again, this is a new button. This is called Community and Voluntary Services. So much the same as these buttons are for clinical lookup, this button is kind of a non-clinical lookup. So things like DEWIS or dementia care or carers groups, anything that's in the community, which in your PCNs or clusters you may work with with third sector providers. That's all in there for you. So you can send that information to us, and we will update that information, and patients can self-refer then to those services. So it's a really good way of just social prescribing, really, isn't it? So that's quite prevalent now, becoming ever more prevalent. So that's available in the app as well. And again, we can update all that information for you without you having to do it. We input it once, and then it's available for every practice in your locality. If you want it to be, we can update it once, and everybody else can download that same template, or we can drag and drop it into different surgeries templates for them without them having to do it. Again, latest news is there. And then we've got other links then for need help getting online. This links to Learn My Way, which is an online platform for patients to learn how to get online, how to use a keyboard, how to use a mouse, how to use online service with a GP. So again, the short informative videos, excuse me, and then they can watch the videos and learn how to get online, just so we don't exclude people from any new services, really. So that's the app's homepage in a nutshell. We've got separate videos then for Health Hub, Your Surgery and What's On. So please do take a look at those. Very quickly, I'd just like to show you in the app's homepage the push notifications, which are completely free. So I'll make this a big screen now. So if you wanted to send a notification to your practice population, it's very easy to do that. Just go to notifications, send a notification, unless, for example, you want to get more people online. You can use our template to register, and then it'll build a template for you. If you're in England, it will not appear with the Welsh translation. And then you can link to the online service registration button. You can send that to all app users. And then once I've sent that out, that's come through to me now on my phone and on my Apple Watch. And if I refresh the app, then the notifications come through. I can look at it, and then it says there, and it'll take the patient directly to the page to register for services. So that's a really good, useful tool, and there's a full audit trail built in to tell you what you've sent out and how many of your patients have actually read that. You can actually download then a CSV of everybody who's read it and upload that as a read code then to your clinical system. You can also build, we've got templates here, which can be used nationally, but you can also build templates which you would use quite often in your practice by using the template notification builder. But again, we can do all that for you. So that's a very brief overview. Very brief, it was half an hour, but as quick, as condensed as we could make it for you on the main features of the app in the app's homepage. So the other 3 tabs are covered in other videos. Please do check those out. All the videos are on our YouTube video and on our website. If you've got any queries or you'd like to discuss this further, please do get in touch. Email us at support@surgeryapp.co.uk or phone us on 01792 344 747. Ask for Steph. More than happy to help and run you through this on a one-to-one team session or whatever you want. Okay, thank you.